So PAHO has had a tremendously long history in primary health care. Member states were present in Alma-Ata in 1978 when the historic declaration was adopted. And I think it's their vision that has really contributed to the progression of primary health care in the region of the Americas. Now, following the adoption of the Alma-Ata Declaration, the world entered a period in which there was a global recession, structural reform processes that essentially impeded the implementation of the vision of Alma-Ata. Unfortunately, we entered into a period where the holistic vision of primary health care was reduced to essential services or minimum packages of services. And what really happened then was there was a segmentation of health systems where unfortunately those that really needed health care could not access it. So PAHO retook that. We retook it in early 2000 and we initiated a process of the renewal of primary health care. And that led to important resolutions within the governing bodies of PAHO in 2004 on the renewal of primary health care. And this was essentially then taken on globally, leading into the adoption of important global resolutions and retaking the renewal of primary health care at the global level. Since then, we've transitioned into a discussion around universal health coverage and what the region has considered is universal access to health and universal health coverage. Universal health coverage is insufficient in itself. What we need to do is break down the barriers to access health services. And so it is part of this now strategy where we say that primary health care is the foundation of universal access to health and universal health coverage. That is where we are today.